I'm stumped. How do I handle unexpected patient reactions or plateaus in progress so that patients don't lose faith or discontinue treatments? Just know you're not alone, okay? This profession that we're in is a lifelong pursuit. We're always learning, and the way we learn is we do get stumped. We find those dead ends. Now, what I'm going to lay out here, I've spoken about this in other places, but I want to kind of put it in one tidy video. I'm going to try to make it rather concise. But essentially, the way we play the game of diagnosis and treatment has to change, and it has to evolve in a dimensional way. And what I mean by that is when we learn Eastern medicine or any other knowledge base, we learn a bunch of facts, a bunch of information. And I call this the earth stage because we're accumulating resources. In this case, it's informational resources. For example, things like chai-hu is an herb. It's cool, releases the exterior, right? Like those kinds of things, all those facts put together. And then once we have that, if we have like 80% retention, which would be amazing, most of us don't have that, right? But even if you had like 80% retention, you then go out into the world, you start practicing. And what we're looking for is for people to kind of ping like those facts, right? Like ping, P-I-N-G, like when you send out a signal and it comes back, right? So you're asking questions. We do these intakes. They're extremely thorough. We ask about every single thing going on with the person, all the way back to what was their mother's womb like when they were living in it? What were the conditions around their conception, all the way to, where we are today? What are your symptoms? Everything. You can have this extensive intake process, and you're collecting facts about that person, and then you're waiting for something to match up in your head to connect back to some other facts that you know. This is the first level of diagnostic skill. And what happens there is essentially we're kind of playing like the shape sorter style thing where we're trying to guess the square shape goes in the square hole, the star shape goes in the star hole, and it can work. We can help a lot of people with that. However, there's always going to be these, significant chunks of outliers who that doesn't work for because they're not static. And what I mean by this is like you move into this next dimension where you're not trying to match. It's not pattern matching. It becomes something else entirely where we're looking at, because here's what happens is you start to try to pattern match, and with these cases, you're going to see like 3, 4, 5, 6, 10 different patterns. So pattern matching immediately, once you're out in the field with complex cases, it falls apart. So we have to evolve past pattern matching, right? So one of the things we can start to do is identify the patterns we do see, and also identify the patterns we don't see that may be present, that are possibilities, and then understand where this person is now. They're going to have predominant patterns. And this is part of understanding order of operations stuff. This is all clinical clarity where we start going, okay, we're going to start with this system first in your body and move into the others because, like, for example, if we clear excess, if we clear wind, or we clear hidden pathogens or something like that, that's going to have a downline effect that oftentimes can clear up other patterns that we thought were important. Because the trouble with that first type where we have all the factual understanding is that everything gets equal weighting. Right, so we look and we go, well, this could be yin deficiency, this could be damp heat, and we're stuck. Flip a coin, right? But once you understand order of operations, you're like, well, if it could be yin deficiency or could be damp heat, then it's not a coin toss. I'm going after damp heat first because that'll give me information, and it is less likely to damage the patient, right? So I know it sounds weird. It's like, oh, how would you clear damp heat without damaging a yin deficient patient? Well, comparatively, you'd rather have that. That's just the way it goes. And a lot of times you start looking at our culture, our society, people have a higher tendency to be damp than yin deficient. Depends on your demographic, right? But I'm giving you an example of how you could take two things that you're struggling to like make a distinction on, and then you go, okay, they don't have equal weight, right? There's going to be a heavier emphasis on one of these things. So for me, with complex chronic conditions, most often it's like damp heat first. And if we do find we actually have yin deficiency, then that'll be much more clear. We get the diagnosis by treatment effect where, okay, I did the damp heat releasing stuff, and now we have X, Y, and Z things left. It looks like you're actually yin deficient underneath all that, but you get the layer of peanut butter off their tongue first, and then you can actually see what's going on, right? So taking all the different treatment principles and all the different formulas and categories of action and all these kinds of things and not having them laid out on a flat array factually, but have them structured. And we move from earth to metal, where we actually have a structured thought process, and we understand which things are the main things, which things are less of the main things, which things are even more obscure. And then you can start to create clinical clarity algorithms where you have a thinking flow chart you follow that can evolve. What happens here? All right, and this is how Doctors Club started. Honestly, I'll tell you, a lot of you have kind of heard this story in different places, but the short version is I had a practitioner reach out about learning herbs, and I thought, okay, fine, we can do that. I had taken a break from mentoring because I was burned out on certain types of low vibrancy levels and things like that. It was a little burnout kind of thing, dealing with the wrong types of practitioners. I didn't know how to filter, but this person was great. I said, yeah, let's do it. However, I know that once you see herbs this way, you're going to start implementing it, and you're going to want to have systems around what you're doing, because you'll very easily be able to go online and still deliver high quality care. So that was the deal. We started working on clinical clarity, fractal systems. The third thing's personal cultivation, which is a bonus, essentially. It's a courtesy to have these things in the program that'll help you understand your own psychology as you move through these layers of growth, and to understand the psychology of the people that you're dealing with, because you're going to challenge them. When you know what you're doing and you offer a real change to somebody, no matter what they say consciously, their subconscious is freaking out because it knows something's about to happen. So people do all kinds of stuff. So anyway, that's all broken down. That's what the program consists of, primarily these three things. Once you have this clinical clarity, the next piece is you're going to want to start to put systems around your work, because we move from solving a pattern, playing pin the tail on the pattern with a flat area of everything has equal weight, right? We move from that to a process where now we know how to iterate and change things. What that does is that changes your first interaction with any potential patient. Because instead of saying, oh, okay, I know what's wrong with you, and here's what we'll try this, we'll try that, whatever, you're sitting down, you go, here's the roadmap. Here's what we do with cases like this. Here's how it tends to change. Here's how people tend to respond. If you respond differently, I'm going to know how to zig and zag with you. It's an iterative process. And now you've helped them see what you can see, which is a roadmap. Now, if you don't understand clinical clarity, and you don't know how to organize things and have order of operations and be able to move through patterns that way, you're not going to be able to communicate that, right? And you don't have to teach the whole thing to every single person, but just laying out the fact that there is a roadmap, there is a plan, that helps. That helps them stay with it. So this question is like two things. It's like, okay, I get stuck, I get stumped. People can reverse respond, or they can plateau. Well, once you have a map, you can see that they're moving from one stage to the next stage to the next stage. You know what the next logical step's going to be, because it's all architected out. This stuff doesn't have to be unobtainable. A lot of times in Eastern medicine, there's this weird tendency we have to do this guru worship, where we make ourselves small in the face of somebody who's experienced and knows what they're doing. This stuff doesn't have to be magic, and we don't have to subjugate ourselves. We can be humble, obviously, right? You don't want to have a crazy ego, but there's no reason that most of us can't be super doctors these days, especially with the right kind of training. So that may scare you, that may freak you out. Guess what? You're in a place, an environment where I plan to help you with what I've said, and that may challenge you, but that's what we do here. Why play small? If we get the one life, why play small? Well, it's safe. Small is familiar. Small is comfortable. Well, not for the people here, not for our annual members, not for me. So if you're the kind of person that holds yourself to that same type of standard, or at least sees a potential to grow and be able to have more of a command over the knowledge base without having a wild ego, right? But be able to be playful with it and start to really understand how these pieces move, a whole world opens up, and these kinds of questions tend to go away. Now, that being said, there still will be difficult cases. There's always going to be difficult cases, but that's an opportunity to start to grow and expand your algorithm and your thinking, so that your branch, right, like your branchy structures of thought, you can have these tiny little twigs on there for the 0.02% or whatever of people who are outliers of outliers of outliers, and they need this kind of treatment. As you grow, you have places to plug that in. But that doesn't mean that, what you need to do for some crazy outlier case has flat weight with every other thing you've learned, right? There's going to be an 80-20 kind of distribution. Then there's an 80-20 of the 80-20 of the 80-20. So we want to keep getting better and better and better and more refined. That way, when somebody does plateau, we know how to pivot. If they don't respond how we were expecting, we know how to pivot. And we've already pre-communicated that to them. They expect that's part of the deal. Now, the next thing on top of that is getting your fractal systems together, right? So that you're communicating that in an effective way and not doing this for 20, 30, 40 minutes every time with every person, because that's going to burn you out, right? So you got to be able to architect things, enter an online program, enter like creating a paracosm, so that you can do this cultural education stuff without having to repeat yourself, 10,000 times and have it get through. That way people are pre-sold on a process. So when things do zig or zag or get weird, it's not a surprise you told them, and they can relax because they know that you got it covered. And then, of course, if you're in this group with us, you see we have people putting in their case studies and, oh, here's this patient again, she tried this and that, and then we had this response, and then everybody chimes in, and we work together like a collective think tank, and we keep to our principles so that it's not just the random shit you see on all the AccuForums, like the things on Facebook, the random advice. It's not that. It's aligned. There's integrity to the line of thought, and you've got a whole bunch of great brains that have your back. So that's how you do that, and especially if you can communicate the process up front and you can start to package an offer together so that people can pre-commit, Like if somebody's bought in on an annual membership, you don't really have to worry about them having 1 week where they're like doubting what's going on, because they're committed, they're in. You've got breathing room, you've got time to go deeper and study and deliver the best care possible. So that's what we do here. All right, hope that helps. Get to work.